Dr. Temitope Ilori. I'm trying to get that name correctly. He's the Director General of National Agency for Control of AIDS. I hope I got it correctly.
Yes, you did.
Ilori. Glad to have you join us on the program.
Thank you.
All right. Well, I must say, from what I've read, doing a very good work. Well, why is it important for Nigeria to reaffirm, like I just read, its commitment to the sustenance of HIV response?
Yeah, thank you very much and good evening. It's quite important because now at this time, we are all suffering from what we refer to as a global, decline in financing in the health sector. Some of our partners are no longer with us, international donors are no longer with us, and even those with us, their involvement has been reduced. Kind of. So this is the best time, more than ever before, to actually walk the talk. We've been talking about country ownership, we've been talking about sustainability. This is the best time to show that Nigerians are actually in charge. And I must commend the President of the Federal Republic of Nigeria, President Bola Ahmed Tinubu, for actually rising up to the occasion. When that issue came up earlier in the year, he actually came up and he put together an inter-ministerial committee headed by the coordinating minister for health, with the minister for finance, minister for budget and planning, and involved. I know a huge sum of 300 billion naira was ring-fenced, not only for HIV but for tuberculosis, for malaria, because these are programs that are heavily donor funded in the past.
Okay, so can you then say that, or let me put it this way, so to what extent has what he has done cover the gap, and how do you intend to, if he hasn't covered it enough, how do you intend to now bridge that gap? I'm talking about funding.
Yeah. Well, what he has done is a step in the right direction, and we are still negotiating for more. We are talking with our National Assembly for more budgetary appropriation for the health sector, and then we are also talking with the states, because health, is on the exclusive list. States also have a role to play, so we're talking with the states using the State Governors Forum, the Spouses Forum, and even talking to the HALGON, the local government, to see how they could also increase their budgetary allocation to health so that we can cover the gaps.
What's their response been like?
It's been very warming, but sometimes action speaks louder than voice.
Yeah, of course, actions you speak louder than words, not just what you say, but what you do. Talk to us about this model, which you say was recognized at the G20 Health Summit in South Africa. What is it about?
Well, it's about, like you said, co-financing. The issue now is that the international body are saying, yes, we could help you, but now it's more like a transitional thing. So we put in 50% of the funds, you match it with another 50% of the funds. So it's like a hand-holding exercise to ensure that, governments, particularly African governments, gets more involved with the health financing.
The gains, again, from what I've read, from what you've said, are quite laudable. It's something that is laudable, the achievements. But what are you doing to improve it? Because you can never really rest on your oars. I mean, somebody says, the day you stop reading, you start dying. The day you stop doing something, you start atrophy sets in. So what are you doing to improve on this laudable achievement, let me call it that I see here?
Well, part of what we're doing is to continue the multi-sectoral response. HIV is not just a health disorder, it also involves a lot of non-health factors, culture, religion, taboos, education, ignorance, they all have a role to play, So we're working in a collaborative effort to ensure that, we engage the community leaders, we engage the religious leaders, we engage even the non-governmental organizations, the civil society organization, and even the patient community are very much integrated into the scheme, into the national response. So we work with all these people so that we can reach the hinterland, the hard-to-reach areas. We can speak their languages. We have information, IEC materials in different languages. We have people specializing in community outreaches. Some are health facility based. So we ensure that, some are targeted at the youth and the young people. We have a lot of interaction with the youth and the young people because they are the most vulnerable, So we do all that using technology. We are on the social media space. We do a lot of interventions that we promote prevention messages to the youth and to the general population.
Now, how do you intend to, quite some important aspects I'll raise with the time we have, but this is a very important aspect of what you're doing. How do you intend to raise the mother to child? Because according to you want to raise the mother to child transmission coverage from, I think, 35% to about 60 to 65. How do you intend to do this? What's your plan? How do you intend to get to that?
Well, what I said is that we've risen, we've actually raised from 35 to about 65. But, like you said, we cannot rest on our earth. We still have to get to 95 or even beyond. Yeah. So how do we intend to do this? Like I said, is the issue of HIV response is a global thing and is a village outreach. So part of what we need to do is to ensure that we have good antenatal care, to ensure that our primary healthcare facilities are appealing to people, to ensure that we have skilled birth attendants in operation and health workers are there and available. So presently we have over 40,000 health facilities offering HIV screening, testing and treatment, in all the 36 plus 1 states. And we use both the local governments, we use the general hospitals, we use teaching hospitals, and we even do community outreaches, like I said earlier. So we're working with other sister agencies, the National Primary Healthcare Development Agency, even the National Health Insurance Scheme. We've started onboarding people living with HIV on such schemes, globally, nationally, And so we are working with different health workers to ensure that we find these women, particularly the pregnant women, we get them tested. As many of them that are positive, we put them on treatment and we ensure that they retain on treatment. Because the good thing is that U equals U. Once they start using their medications, the virus is so suppressed that it becomes undetectable. And what is undetectable is untransmittable to their unborn children. So now, we have so many, not so many, but we have HIV positive women giving birth to HIV negative women, negative children. In fact, we have some HIV positive people married to HIV negative spouses and they're having negative children.
So when it's undetectable, it's not transmissible.
Exactly. U equals U. Undetectable equals untransmissible.
U equals undetectable.
Yes, letter U equals undetectable equals untransmittable. And what that means is that we have very potent medications that if you start the medications within 6 months, the viral load will be so suppressed that you cannot transmit.
Wonderful. Thank you so much, Dr. Temitope Ilori, that's it here, Director General of the National Agency for Control of AIDS, for being here.
Thank you so much for having me.